For decades, electronic registration of births and deaths of Gambians and those living in the Gambia was virtually non-existent. Stockpiles of manual registration books dating back to time immemorial had existed for several years, making retrieving and processing of vital data a challenge. This is now set to change.
The systems all along had been ledger manual processed, and then we have challenges along the line. This includes data collation is one, archiving the data is two, retrieving the data from the database is also a problem. So if the people should get loss of their certificates, they find it difficult to retrieve the certificates. And also those registered in the provinces, you cannot have their data at the central level.
The Ministry of Health, with support from the World Bank, in its strive to digitize the civil registration and vital statistics systems in the country, embarked on a mass birth registration and health insurance membership registration across the country from August 1st, 2022 to December 2022. It started in the West Coast region, to the North Bank West and East, to the Lower River region, to the Central River region, and finally to the Upper River region.
The National Health Insurance Scheme is a scheme that is going to be rolled out by government to ensure that families, communities have access to health service at a cost that they can be able to afford. And then the insurance scheme also will also be there to ensure that people also are able to, to ensure that they don't incur cost on healthcare service delivery. For example, if they are to seek for services, the cost should be at a cost where they can be able to afford.
Congratulations to the Ministry of Health for embarking on a journey to make civil registration and vital statistics and health information system fully digital in the Gambia. An electronic CRVS system has multiple benefits for individuals and the society as a whole. It is the foundation for e-government and would allow several sectors to provide public health essential public health services which are effective and efficient. The birth certificate with the national identification number assigned to it would facilitate enrollment into the National Health Insurance Scheme. Can you imagine the additional resources that would have been required if the government had decided to undertake a standalone registration into the National Health Insurance Scheme?
His Excellency Adama Barrow, President of the Republic of the Gambia, along with the First Family and Honorable Minister of Health, were registered in the presence of the media. During the campaign, the following documents are required to obtain the new birth certificate, and the following categories of people need to register their birth. Persons born in the Gambia to one or both Gambian parents. Persons born in the Gambia to parents who are non-Gambians. Persons born in the Gambia to parents who are refugees resident in the Gambia. Persons born outside the Gambia to Gambian parents. People who want to register should bring the original copy of an authentic birth certificate to get a new electronic birth certificate with security features that are difficult to forge. No other documents are required if you have a birth certificate. If you do not have a birth certificate, you can bring one of the following documents: a valid national identity card, or an infant welfare card, or an antenatal card for a newborn, or a passport, or an alcalos attestation, endorsed by the Chief District Executive or Mayor. However, if you are under 50 years old, then you need to also bring along supporting documents from one or both biological parents, including a parent's birth certificate, or a parent's national identity card, or a parent's infant welfare card, or a parent's passport, or a parent's death certificate. If you are 50 years old or older and registering yourself, then you do not need to bring your parents' supporting documents. To obtain a national health insurance card, you need to be a Gambian. If you are not a Gambian citizen, but you are a legal resident in the Gambia, then please bring along your resident permit or any documentation indicating legal residence in the Gambia for at least 6 months.
The procedures at the registration center are as follows. You must be physically present, that is, appear in person at the registration center. Underage 0 to 18 years are to be under the company of a caregiver. At the registration center, all are required to follow the queue except the elderly, pregnant and lactating mothers, the sick and differently abled. Hand over all required documents to the registration officials for processing and registration. A birth certificate and a national health insurance card will be issued after the completion of the process. The NHIS will cover many health services you may need, such as outpatient and inpatient services, dental health services, immunization, eye care services, maternity care, internal medicine, pediatrics, and emergencies.
When a person goes to a registration center, his or her biographic information, such as name, sex, date of birth, and so on, is recorded electronically, along with having his or her photograph taken. This information is checked immediately on site by a registrar, and the person receives a birth certificate printed on a security paper with a watermark of the Gambia coat of arms. The birth certificate has a national identification number and a QR code printed on it. These features will make it hard to forge. While at the registration center, he or she would also receive a national health insurance card which has the national identification number, QR code, and photo. Again, these features will be difficult to duplicate.
Before the mass registration exercise was initiated, public sensitization campaigns were conducted to generate demand by engaging community leaders through various television and radio programs, community engagements, press briefings, and regular updates of activities through social media via the Ministry of Health official Facebook page. Enquiries are also made available through a toll-free line 1025.
We should all take part, we should all participate. I think it's good for every individual. You should not be left over. You should be within, as far as I'm concerned. As we start, make sure you be the first person and jump into the boat, because it's very important. If you miss this, you will struggle to maintain your health bills, and the government is doing everything to help everyone. So the entire population of the Gambia should know that this is very important and it's good for the country and good for the people of this country.
We should actually come out in big numbers and queue and patiently wait for us to be called to go and then get our enrollment cards done. This is an opportunity for you to get yourself out of spending, direct spending on healthcare.
This campaign is for women. We are the one who is bearing children, and we are the one who used to take our kids to the hospitals, and the healthcare system is our duty, because even our husband, we take care of them. So I'm urging all of them to come out with full force with their family, encourage their family. Anything what women lead, it's going to be successful. So everybody should come out and register on this thing, this certificate, so that you can be a holder of a certificate and also the change of your new birth certificate.
Don't be left out. Register for the electronic birth certificate now to become a member of the National Health Insurance Scheme.
While carrying out the mass registration, some lessons were learned and appropriate corrective actions were undertaken, which contributed to the success of the registration. Long queues across centers and massive turnouts across a wide and diverse population has been the hallmark of the registration campaign. Some centers are so overwhelmed that they have to stretch beyond normal working hours to satisfy the population. Some people even arrived at the registration centers at dawn or slept there overnight. During the registration exercise, some communities raised concerns regarding the spelling of their communities in the electronic civil registration and vital statistics system and refused to register. The Gambia Bureau of Statistics provided the names of communities which were used in previous reports, but people had different spellings for the same communities. This was a huge controversy that would have derailed the exercise. The Ministry of Health reached out to the Ministry of Local Government and Lands, which engaged regional authorities and community leaders to update the list. Special arrangements were then made to go back to the communities, such as Sintet, to register people with updated community names. In any mass registration exercise, errors occurring in some birth certificates is inevitable. The Birth and Death Registry Unit worked closely with WCC, the software developer, to enable the system to make corrections. A detailed portal was set up to allow the public to use mobile phones, tablets and laptops to report errors on the birth certificates. Once a correction was made, the individual was called to go to the nearest registration center to pick up the corrected certificate. This was the first time that the Ministry of Health used electronic payments for such a large campaign. Having more than 1,500 registration officers signing paper timesheets made it difficult to collate and make payments. Eventually, an online attendance register was created to facilitate the processing of payments. Through mass media, the public was informed of the registration schedule well ahead of the arrival of the registration teams in their communities, which allowed communities to prepare for the arrival of the teams. Regular monitoring of the daily registration data revealed trends which informed implementation. For instance, when registration teams move from one location to another, the number of registrations decreased in the first few days at the new center and then picks up again, so team movement within regions was decreased. Online registration with issuance of a national identification number required regular internet access. This was initially a challenge given poor network coverage in some areas. The cellular network was mapped and Intersat was engaged to provide satellite connectivity in dead zones. WCC, the software developer, was regularly available even on weekends to troubleshoot any problems that arose. Supported by the World Bank, this important project is envisaged to change and improve healthcare services in the Gambia, thus advance the socio-economic lives of all residents of the Gambia.